Okay, welcome to the deep dive. Today, we're tackling a topic that's, well, it's incredibly close to the chest, sometimes literally, for anyone who uses their voice, especially singers.
Hmm.
We're diving into that frustrating, often kind of elusive thing called vocal tension. That feeling like something's holding your voice back, like a kind of straitjacket around your sound.
Yeah, it's a really common feeling.
We've got a wealth of material here, actually, from one of our listeners' articles, research papers, some personal notes, too, all focused on understanding this tension, figuring out where it comes from, and maybe most importantly, how we can release it, how we find what singers often call vocal freedom.
Right.
So, our mission in this deep dive is basically to pull out the most important nuggets of knowledge, the key insights from these sources, to give you a clearer picture of what's going on and hopefully some practical ways to start letting go.
And it's such a crucial topic, really, because vocal tension is, well, you could argue it's the biggest barrier for many singers. It just stops the voice from working efficiently, doesn't it? It limits your expression, and often it just causes discomfort or even pain. So learning to address it isn't just about sounding better. It's fundamental for healthy, sustainable singing, for unlocking your unique potential.
Absolutely. And right off the bat, the sources bring up this really interesting question. If singing is such a natural human thing, I mean, we hum, we sing lullabies, kids just belt it out without thinking, well, why does it so often get tangled up in all this tension?
That's the puzzle, isn't it?
Yeah, and why isn't the advice just relax, the easy fix, it sounds like? Because it seems like some muscle activity is actually essential for singing, right? It's not about being totally floppy.
That's exactly where the nuance comes in.
Yeah.
You're right. Producing sound is a physical act. It absolutely requires muscle engagement. Your diaphragm needs to work. Your vocal folds need to come together efficiently. Muscles shape the sound.
Mm.
So complete relaxation, like total flaccidity, that would make coordinated singing impossible. Your body needs appropriate tone. The term is often tonus, a kind of healthy readiness in the muscles. The problem isn't muscle activity itself. It's the wrong kind of muscle activity, or maybe too much of it in the wrong places.
Okay, so if it's not just any muscle activity, what kind of tension are we actually talking about here? How do the sources define this, like problematic tension?
Well, the focus is on unhelpful or excessive tension. Think of it as muscular effort that interferes with or restricts the body's natural, efficient way of making sound.
Right.
So instead of supporting the voice, these muscles are kind of working against the ideal function. They're often trying to force something, maybe compensate for a weakness somewhere else in the system. It's like trying to drive with the handbrake on.
That makes a lot of sense. So where does this interfering tension usually come from? Is it always down to bad technique?
The sources point to several common origins, and yeah, often they're interconnected. Poor technique is definitely a major one. If you're, say, pushing for power or trying to hit high notes without a solid foundation underneath, other muscles will jump in to help, but in ways that are actually counterproductive.
Mm-hmm.
A huge culprit that comes up again and again is insufficient breath support.
Huh.
If your airflow isn't managed effectively from down low, your throat or neck might tighten up to try and control the sound or manage the pressure.
Ah, okay, compensation.
Exactly. And sometimes it's just simple unconscious habits. Singers might try to energize the sound by adding this muscular squeeze instead of relying on efficient airflow and resonance.
And I guess these tensions don't just stay put, right? If I feel tight in my jaw, say, can that cause problems elsewhere, like a chain reaction?
Precisely. The vocal mechanism is this beautifully complex, interconnected system. The sources really stress this point. Tension in your jaw, for instance, isn't just a jaw issue. It's got muscular links to your tongue. And both of those can influence the position and the freedom of your larynx, your voice box.
Oh.
And tension in your neck often relates back to how you're breathing or how you're holding your body, your posture. So yeah, it's rarely just one isolated thing. It's more like a network of tension.
So the real challenge then for singers is learning to tell the difference between that helpful engagement, the core support that feels grounded but dynamic, the focused muscles you need for clear words, learning to tell that apart from the constricting tension, the kind that feels tight or squeezed or just effortful in the wrong way. How do you even begin to figure that out?
Well, that's where developing body awareness becomes absolutely fundamental. You almost have to become a detective in your own body.
Yeah.
Learn to recognize the feeling of efficient, coordinated effort versus the feeling of unnecessary squeezing or gripping. And like you said, it's not about being floppy that just leads to a weak, breathy sound because the vocal folds aren't meeting properly. The goal is coordinated, dynamic function, muscles engaging just enough to do their job efficiently without extra stiffness or constriction. You need that appropriate muscle tone, that tonus, for singing that feels energized but also free, not strained.
Okay, so if the straitjacket is this unhelpful tension, then the goal is vocal freedom. What does that idea really mean? Is it just about not being tense, or is there more to it than that?
Oh, it's definitely more than just not being tense, though that's obviously a huge part of it. Vocal freedom, according to these sources, is really about singing without physical restriction. It's about allowing your voice to respond spontaneously, authentically to whatever you intend musically.
That
It's
is.
kind of like when your body is so aligned and efficient that it just gets out of the voice's way, letting your sound truly express what you want it to without interference.
So what would that look like or sound like? Are there like observable signs of a voice working with that kind of freedom?
Yeah, typically you'd see a larynx, the voice box, that stays relatively stable and released.
Mm.
It's not bouncing around or riding unnaturally high in the throat.
Mm.
Your breath management feels efficient and sufficient. It just smoothly fuels the sound without you feeling like you have to force it or push it.
Mm-hmm.
Articulation is clear, it's agile, but it doesn't feel like you're working hard at it.
Effortless.
Kind of, yeah. The singer has easy access to their full range. They can explore different resonance qualities, different colors in the voice, and they can use dynamics, singing loud or soft, without introducing strain.
Right.
It's basically what happens when the foundational mechanics, things like your posture, your breathing, how your vocal folds actually vibrate, where the sound resonates, clear articulation, when all those things are mastered and integrated, the technique becomes almost second nature, internalized.
So you're not thinking about it anymore.
Exactly. That allows you, the simmer, to move beyond worrying about the mechanics and just fully focus on communicating the music, the story, the emotion.
And you mentioned earlier the sources hint that it goes even deeper than just physical technique.
That's a really crucial layer that comes through strongly in the material, yes.
Mm-hmm.
Vocal freedom seems deeply intertwined with personal growth, with your psychological state. It often involves releasing not just physical habits, but also maybe limiting beliefs or fears you might have about expressing yourself.
Interesting.
The voice is so tied to our identity,
Right.
our vulnerability. So if you're holding back emotionally or psychologically, that can absolutely show up as physical tension in your body, which then directly impacts the voice.
Wow, okay.
And this just underscores the holistic nature of singing. It engages your whole being: body, breath, mind, voice.
Yeah.
They're inseparable, really. Your posture is the frame, breath is the fuel, and your mental and emotional state profoundly influences both your tension levels and your ability to express authentically. That's why working on one area, say improving your posture or learning to manage performance anxiety, can have these positive ripple effects. You might find less tension in your neck, your breathing becomes freer, your voice feels more stable and responsive. It's all connected.
Okay, so let's get specific then. Where does this unhelpful tension typically set up shop? If someone's listening and feeling restricted when they sing, where should they maybe investigate first?
Identifying those common hotspots is definitely step one. The sources give us a kind of roadmap, showing the areas where singers most often hold tension. And often it's because of that compensatory pattern we talked about, muscles trying to help the sound when the foundation isn't quite there.
Right, trying too hard in the wrong place.
Exactly. So the first major area mentioned is the jaw. This seems obvious because we use it all the time for talking and eating, but for singers, oh boy, it can be a huge source of unnecessary gripping. Those masseter muscles, the main chewing muscles along your cheek, they're incredibly strong.
So what are the clear signs? How would I know if my jaw tension is messing with my singing?
Well, pay attention to whether you have difficulty dropping your jaw easily, especially on open vowels like ah. Does your mouth opening feel small or tight? Or does it feel like your lower lip is pulling down rather than the jawbone itself releasing downwards?
Yeah.
Jutting the jaw forward, especially when you go for higher notes, that's a very visible sign. You might also notice a slight wobble or tremor in the jaw sometimes, or catch yourself clenching your teeth between phrases, or even during sustained notes.
Okay. And what causes that? Is it just stress?
General stress definitely contributes. Lots of us clench our jaws without realizing it. Poor overall posture can play a role too. Pushing the head forward often encourages jaw tension. But a really key cause for singers, according to these sources, is using the jaw to compensate for inadequate breath support. It tightens up to try and hold or control the sound when the air isn't doing the job properly.
Ah, okay.
Also, sometimes misguided attempts to create a big sound by, like, forcing the mouth really wide open can actually backfire and create more tension.
Yeah. And the impact. What does a tight jaw do to the sound?
It can definitely alter your vocal tone. Often makes it sound thinner, maybe more squeezed, less resonant, less full. It certainly messes with clear articulation and getting pure vowel sounds. And as we mentioned, it's very, very tightly linked to tongue tension.
Right, which brings us to the tongue. You said that's connected.
Absolutely. The tongue is this incredibly complex network of muscles. It's crucial for articulation, obviously, but also for shaping the vocal tract, which affects resonance. And critically, it connects directly to your larynx via the hyoid bone, that little floating bone under your chin.
So tongue tension can actually pull on your voice box, affect its freedom.
Precisely. Signs of tongue tension include the tongue pulling back or maybe bunching up in the back of your mouth, instead of resting relatively forward with the tip gently behind your lower front teeth.
Okay.
You can look in a mirror. Do you see visible ridges or grooves on the top of your tongue? Does it feel flattened or thick? You might notice twitching during sustained notes or find quick consonants like all, T's, E, H, she difficult or sluggish.
Yeah.
A really critical sign. Feel the soft tissue under your chin in that hyoid region when you try to sing or hold a note. Does it get hard or stiff? That's often the back of the tongue pressing down or pulling back, especially common when singing higher pitches or ascending lines.
And what causes that? Is it the same breath issue?
Yeah, again, a primary source highlighted strongly in these materials is compensation for inadequate breath support or energy. The tongue tries to control the airflow or manipulate the sound quality when the breath isn't providing that stable, consistent energy.
Makes sense.
But it can also stem from incorrect vowel shaping, trying to force certain sounds. Just plain old unconscious habit, maybe psychological stress, or even mimicking the tension patterns of other singers. The sources really flagged tongue tension as a major factor in vocal problems for a lot of people.
And the impact sounds pretty significant.
Oh, it is. A tense, retracted tongue can pull down your soft palate, which can reduce that nice, buzzy nasal resonance and make the sound kind of muffled or overly throaty. And because of that direct connection to the larynx, tongue tension can pull the larynx higher than ideal.
Which affects pitch.
Yes, it negatively impacts pitch accuracy, tone consistency, makes it harder to navigate, register breaks smoothly,
Yeah.
moving from chest voice to head voice. It limits your overall vocal range, top and bottom, and definitely contributes to vocal fatigue much faster.
Okay, moving up. Neck and shoulders. Another classic tension spot, right?
Absolutely. These muscles support your head and neck. They house the larynx, and they include what we call accessory breathing muscles like the SCM, those big muscles down the side of your neck, and the scalenes. Overusing those for breathing instead of your diaphragm and ribs, that's a big red flag for inefficient breathing and potential tension.
So if I notice my shoulders creeping up towards my ears when I inhale, or my neck feels tight after singing, that's a sign.
Definitely. Signs are often quite visible. You might see the head jutting forward from the body's center line, that forward head posture. Shoulders that are elevated or rounded forward or hunched. Sometimes you can even see visible strain, like bulging veins in the neck during difficult passages, or just that general feeling of stiffness and pain in the neck and shoulder area.
And the causes. Similar themes.
Often, yes. Poor posture is a huge starting point, especially that forward head posture from, looking at screens all day. Incorrect, shallow breathing that relies on lifting the chest and shoulders instead of that low torso expansion is a major factor.
Right, the inefficient breathing again.
Exactly. And again, insufficient breath support from below means the neck and throat muscles try to take over some of the work. Psychological stress tightens these muscles automatically for many people. And certain technical challenges, like navigating register transitions or trying to force vibrato, can also trigger neck tension.
And the impact here. Straight to the voice box.
Pretty much. Neck tension directly compromises the freedom of movement and the optimal resting position of your larynx. This makes singing less efficient, it restricts your breath capacity and airflow control, and it leads directly to that feeling of tightness or strain in the throat area.
Okay, let's zoom in even closer then to the larynx and throat itself. The voice box, where the vocal folds live.
Right. It's suspended by external muscles, the extrinsic ones, and contains internal muscles, the intrinsic ones, that control the folds for pitch and closure. And then you have muscles in the pharynx, the back of the throat, which also influence resonance.
So tension right there at the source of the sound. That sounds pretty serious.
It is, and it's often a direct result of tension elsewhere, especially, again, breath issues forcing the throat to compensate. Signs include that persistent feeling of tightness, constriction, squeezing, like a lump in the throat feeling, or a sensation that things are closing in. Pain during or after singing is a serious red flag, obviously. You might notice your larynx, your Adam's apple area, the thyroid cartilage riding abnormally high at rest, or staying high when you sing, instead of having a relatively relaxed lower resting position.
Okay.
A voice quality that sounds pressed, strained, forced, or tight, and experiences rapid fatigue, those are also key signs. Sometimes even difficulty swallowing can be linked to chronic laryngeal tension. And then there's pharynx constriction, tightening the back of the throat, which might be used intentionally in some styles, but often it's just rigid, unhelpful tension.
And the causes for that specific tension.
A significant one mentioned is misusing those extrinsic muscles around the larynx. Basically, using muscles that are designed for swallowing or maybe lifting to try and control your pitch or the quality of your sound. Often this happens because the breath mechanism isn't providing stable support from below.
The compensation pattern again.
Exactly. Poor breath support overall forces the throat to try and help make the sound happen or regulate the airflow. Incorrect technique is a big one too, like trying to push your chest voice way too high without learning how to navigate the transition properly, or just forcing high notes. And of course, psychological stress, anxiety, fear, those can cause direct, immediate laryngeal tightening. Even poor speaking habits can carry over into singing.
And the impact sounds pretty devastating for the voice.
It's profound. Laryngeal tension directly interferes with the efficient, easy vibration of your vocal folds. It constricts the resonant space above them, making the sound smaller, thinner, more strained. It severely compromises your range, your flexibility, your ability to sing dynamically. It leads to quick fatigue and significantly increases your risk of vocal injury, things like nodules or polyps.
Okay, moving outwards a bit. What about the face and lips? Is tension there as critical?
Maybe not as directly damaging in the same way as deep throat tension, but it's definitely a visible sign of unnecessary effort, and it can still impact the voice. Plus, it affects expression, obviously.
So what should I look for in the mirror here? What are the signs?
Common things are chronically raised eyebrows, especially when going for high notes or concentrating really hard, frowning or furrowing your brow, lips that look thin, tight, or overly stretched horizontally. Sometimes the upper lip seems to pull up and hide the upper teeth, or the lower lip gets pulled down excessively. You might see overly puckered lips, or lips that quiver when holding a note. A forced or fixed smile that doesn't look natural is another sign. And difficulty with the rapid, relaxed lip movements needed for clear articulation.
What causes that kind of tension? Is it just concentration?
Intense concentration can definitely trigger it. Sometimes it's an unconscious effort to restrict airflow, or just an attempted expression that comes out tense. Often, though, it's another compensation this time for a lack of breath resistance from below. The lips tighten to try and control the air escaping when the body isn't managing it effectively. Habit plays a role, mimicking others, general psychological stress, and very frequently it's linked to underlying jaw and tongue tension. They often go together.
And the impact. Does it affect the sound much?
Well, maybe less direct than the deeper tensions, facial tension can affect the larynx. For example, chronically raised eyebrows can subtly pull the larynx upwards. Frowning can create a feeling of constriction. It certainly hinders clear articulation if the lips are tight, and it can contribute to a thinner, less resonant tone quality. But mainly, it's a really noticeable indicator that you're working harder than you need to. Addressing it often involves looking at the underlying breath or jaw issues, along with just using a mirror for feedback.
Okay, now let's talk about the source of power itself. The abdomen and breath, this is where it all starts, right? The diaphragm, the abs, the intercostals managing the air.
Exactly. This is the engine. The diaphragm initiates the inhale, and then the abdominal and intercostal muscles work together to control the exhale, manage the airflow, and create the right amount of subglottic pressure coordinated with the vocal folds resistance.
So how can tension show up there? That seems counterintuitive if it's supposed to be the source of support.
It does seem counterintuitive, but it's incredibly common and actually quite damaging to efficient singing. Signs include things like forceful abdominal clenching, really yanking the belly inwards sharply during exhalation instead of a controlled, dynamic engagement.
Right.
Shallow, high chest breathing, where you see the shoulders visibly lifting on the inhale, that's a major sign of inefficient breathing, which often leads to tension elsewhere, trying to compensate. And also, rigid gripping, just holding the abdominal muscles tightly and flexibly throughout the entire breath cycle. That's tension too, preventing the natural flexibility needed for responsive breath control.
What causes people to do that? Why grip the abs?
Often it's a fundamental misunderstanding of what support actually means in singing. People hear support from the core and think it means forceful gripping or pushing.
Ah, like bracing.
Exactly, like bracing for impact, rather than a dynamic, controlled release of air. It's often a lack of understanding or practice of low diaphragmatic or maybe costal rib breathing. Poor posture can physically restrict the diaphragm's movement, making low breathing difficult. And anxiety often leads to that rapid, shallow chest breathing pattern.
And the impact, if you're tense in your core.
This is crucial.
Mm.
This kind of excessive abdominal tension paradoxically makes effective breath support harder. It limits the dynamic control you need for different phrases, dynamics, and pitches. And when you have insufficient or poorly managed airflow coming from below because of this gripping,
Other muscles have to jump in.
exactly, it forces other muscles, typically in the throat, neck, and jaw, to compensate, to try and create the necessary pressure or control the airflow artificially. And that leads to strain in those areas. It limits your phrase length, your power, your stamina, and makes the whole process of voice production feel incredibly effortful, even if you feel like you're working hard in your abs.
Wow, okay. And finally, the big picture, overall posture. You said this is the absolute foundation.
It really is. The sources emphasize posture, your skeletal alignment, how your head, spine, rib cage, pelvis, legs, feet are all lined up as the structural foundation for everything else. Efficient breathing, deficient phonation.
What are the signs of poor posture that singers should look out for?
Things like slouching, a rounded upper back, kyphosis, that forward head position we keep mentioning, a collapsed or sunken chest or sternum, locked knees when standing, uneven weight distribution between the feet, shoulders that are habitually rigid, rounded forward, or held high towards the ears.
And causes. Just bad habits.
Often, yes.
Huh?
Ingrained habits developed over a lifetime, sometimes just a lack of body awareness. There could be physical factors too, like muscle imbalances or old injuries. And psychological factors definitely play a part. Lack of confidence or chronic stress can make you physically kind of contract or curl inwards.
And the impact of poor posture on singing sounds like it would be massive.
It's profound and really far-reaching. Poor posture directly restricts your lung and rib cage expansion, which severely limits your breath capacity and your control over your breath.
Right.
It destabilizes the larynx, making it harder to maintain consistent pitch and tone quality because its supporting structures aren't aligned. It negatively impacts resonance and projection because the shape and alignment of your vocal tract are compromised. And critically, it contributes to increased muscle tension throughout the rest of your body, in your neck, your shoulders, your back, even your jaw. It creates this vicious cycle of inefficiency and strain.
So it all connects back.
It really does. Research actually shows that different postures measurably alter how your muscles activate when you sing. Some postures just inherently make you more prone to developing tension than others.
Okay, so summing up these hot spots, the really key takeaway seems to be understanding that tension in places like the jaw, the tongue, the neck is often a symptom, right? A symptom of something deeper, frequently related to inefficient breath support that might stem from poor posture or just incorrect breathing habits.
That's a great summary. Addressing only the symptom, like just trying to relax your jaw, might give you temporary relief, but for lasting freedom, you usually need to dig deeper and fix the root cause. Often that means going back to the foundation, breath and posture.
And you mentioned earlier, a lot of these signs are actually visual, things you can see in a mirror or a teacher could point out.
Exactly. Using a mirror or recording yourself or getting feedback from a trusted teacher or coach can be incredibly powerful diagnostic tools because your own internal sense, your proprioception of what feels normal can be really misleading if you've been singing with these tension patterns for a long time. They start to feel like just how you sing. Visual feedback helps you objectify it and start to correct it.
That makes so much sense if the engine, the breath, isn't working right because the frame, the posture is out of whack. Then yeah, other parts like the jaw and throat have to work overtime and get tense. Okay, so knowing where tension shows up is step one. How do we start building that solid foundation you mentioned to release it? It sounds like it's not just about fixing one tense muscle in isolation, is it?
Exactly right. The sources strongly emphasize that building vocal freedom really starts with creating a synergistic foundation. And the three pillars of that foundation are breath, posture, and body awareness. They all have to work together.
Okay, let's dig into that. Let's start with the power of breath. Diaphragmatic breathing and control. You've already stressed how critical breath is.
Yes, because it's the voice's energy source, its fuel. And as we've seen, inadequate or poorly managed breath support is probably the primary driver of that compensatory tension elsewhere in the body. Diaphragmatic breathing, really engaging the diaphragm muscle and allowing expansion in the lower torso, so the belly, the sides, the ribs, even into the lower back. That's generally the most efficient way for singers to get sufficient air capacity, sustain airflow smoothly, and control the breath pressure with much less strain compared to shallow chest breathing that just lifts the shoulders.
And you said it's about managed airflow, right? Not just about taking huge gulps of air and blasting it out.
Precisely. Singing breath is all about coordination. You need your lower torso muscles, the diaphragm working with the abdominals and intercostals to create and manage the air pressure below your vocal folds. It's called subglottic pressure. Then the vocal folds themselves regulate how that air is released. That's called glottal resistance. For efficient free singing, you need a steady, managed airflow meeting just the right amount of resistance from the folds. It's a balanced system. It's not about forcing huge volumes of air out, nor is it about squeezing the throat shut to hold the air back.
So how do you practice this diaphragmatic breathing? What's a good practical way for someone to start learning or reconnecting with it?
Well, a classic and very effective way to begin is by lying on your back, maybe with your knees bent and feet flat on the floor. Place one hand lightly on your chest and the other on your belly, just below the navel.
Okay.
As you inhale, the goal is to feel the hand on your belly rise noticeably, and also sense your lower ribs expanding outwards to the sides, maybe even feeling some expansion into your lower back against the floor. Your chest hand should remain relatively still and your shoulders should stay relaxed, not lifting up. Inhale gently, maybe through your nose or mouth, whatever feels easy and open, not forced. And the exhale should feel like a slow, controlled, gradual return to a relaxed state. The key feeling is that low, open, easy expansion on the inhale.
Okay, that makes sense. And once you have that basic awareness, how do you build control? What kind of exercises help?
Right. Awareness is step one. Control is step two. The sources suggest several breath control exercises. First, the sustained hiss or buzz, zzz or zzz. After you take that low, relaxed inhale, you exhale on a steady, even zzz sound, like air leaking from a tire or a zzz sound. Try to keep it going for as long as you can maintain a perfectly consistent, smooth sound. The goal here is steady airflow, and you should start to feel a gentle, sustained engagement in your lower abdominal area on the exhale. That's your support kicking in to manage the air pressure.
Okay, I can picture that.
Then there's pursed lip breathing. Inhale gently, maybe through the nose, then exhale slowly and steadily through lightly pursed lips, almost like you're gently blowing out a candle or through a thin straw. The key here is to make the exhale much longer than the inhale. For example, you might inhale for a count of 4 and exhale for 8, 10, 12 counts or even more. This really helps build fine control and a sense of resistance in the exhalation process.
Right, controlling the release.
Exactly. Another category is slow or counted breathing. Practicing structured breathing patterns using counts can be very helpful. Simple ones like inhaling for 4, holding gently for 4, exhaling for 4, box breathing, or maybe inhale 4, hold 7, exhale 8, that's known to be very calming, or just matching the inhale and exhale like 5 ins, 5 out. The focus here is on achieving smoothness, evenness, and relaxation throughout the entire cycle. It also helps regulate your breathing rhythm and calm the nervous system.
Good for anxiety too, probably.
Definitely. And related to that is alternate nostril breathing. This is a yogic practice, pranayama. You use a finger to gently close one nostril. Inhale slowly through the open one. Then close that one, switch, and exhale slowly through the first nostril. Then inhale through that same side, switch, exhale, and so on. It's known to be very balancing and calming for the nervous system and helps focus the mind on the breath.
Interesting.
A simpler one is just sighing breaths. Take a comfortably deep, slow inhale, maybe through the nose, and then exhale fully with an open, relaxed ah sound, like a sigh of relief. This actively encourages the release of tension, especially any holding in the throat, chest, or shoulders. Feels good too. And finally, a concept called breath suspension. This involves a brief, gentle pause or suspension of movement right after you've finished inhaling before you start to sing the phrase. It helps create a sense of stability and readiness, allowing the support mechanism to engage before phonation begins. But there's a crucial point here emphasized in the sources. This suspension should come from maintaining the feeling of torso expansion, keeping the ribs open, not from closing your vocal folds at the throat. That would be a harmful glottal stop, creating tension right where you don't want it.
Okay, that's a really important distinction. Suspension from the body, not the throat.
Got it. What are the most common mistakes people make when they're trying to work on their breathing for singing?
Oh, several common pitfalls. Forcing the inhale, making it fast, noisy, or gasping. breathing erratically, not finding a smooth rhythm, over-relying on lifting the chest and shoulders instead of really accessing that low torso expansion that's probably the biggest one, and also just holding unnecessary tension throughout the entire breath cycle, including gripping during the inhale rather than letting it be relaxed and receptive. Okay, so breath is pillar one. What's pillar two? You mentioned posture.
Yes, posture as the pillar. As we discussed when talking about the tension hotspots, your skeletal alignment, your posture, is the physical framework for absolutely everything else in singing.
Why does it have such a massive impact? Can you elaborate on that connection again?
Absolutely. Because good, balanced alignment directly enables, or poor alignment hinders both your breathing and your vocal production. When you're well aligned, it allows for full, unrestricted expansion of your lungs and free movement of your diaphragm. Simple mechanics.
Right.
It also helps stabilize your larynx in a relaxed, optimal position, free from unnecessary pulling or strain from surrounding muscles. And it helps optimize the shape and size of your resonators, the spaces in your throat, mouth, and nasal passages where the sound gets amplified and colored. Conversely, when your posture is poor, say, you're slouching or your head is forward, it physically restricts your breath capacity and control. It can destabilize the larynx, affecting pitch and tone. It negatively impacts resonance, making the sound less vibrant. And, as we saw, it creates that cycle of compensatory tension throughout the body. Research confirms this posture has a direct, measurable impact on how your muscles activate when you sing.
And it's not about being stiff like a soldier.
Not at all. That's
Yeah.
a common misconception. It's not about holding a rigid military stance. It's about finding a dynamic balance, a centeredness. Your skeleton provides the support, and your body feels aligned, grounded, but also responsive and ready for movement.
So what does good singing posture look and feel like practically? What are the key points to aim for?
Think of it as stacking the blocks. Your spine. You want to maintain its natural curves, a gentle inward curve in the lower back, outward in the upper back, inward in the neck. Your head, rib cage, and pelvis should feel vertically aligned, balanced over each other. Avoid excessively arching your lower back or rounding your upper back too much. Your head and neck. Your head should feel like it's floating easily on top of your spine, not held rigidly. Imagine a string gently pulling upwards from the crown of your head. Your ears should be roughly aligned over your shoulders. Avoid letting your head jet forward or tilt awkwardly. Maybe a gentle nod or chin tuck to release the back of the neck. Your shoulders, they should be relaxed down and slightly back, think wide collarbones. This allows your chest to feel open, not collapsed. Your shoulders should be centered over your hips, not slumped forward or hiked up toward your ears. Your sternum and ribs. Feel a sense of gentle, buoyant lift in your sternum, your breastbone. This isn't about puffing the chest out aggressively, but allowing your rib cage the freedom to expand fully in all directions on the inhale forward, out to the sides, and even into the back. Avoid letting your chest collapse downwards. Your pelvis and hips. Aim for a neutral pelvic position. Imagine your pelvis is like a bowl of water. You don't want it tilting so far forward that water spills out the front or so far back that it spills out the back. This avoids strain on the lower back and allows for proper abdominal engagement, your knees and feet. Keep your knees soft, slightly bent, never locked straight back. Stand with your feet roughly shoulder-width apart, weight balanced evenly, maybe with one foot slightly forward for a bit more stability, especially when you're actively singing. Feel grounded through your feet.
Okay, that's a great checklist. Are there specific exercises people can do to improve their posture awareness?
Definitely. Simple things like standing with your back against a wall, heels, hips, shoulders, back of the head lightly touching can help you feel that alignment. Gentle wall slides can mobilize the shoulders. Yoga and Pilates are fantastic for building core strength and postural awareness. Exercises using resistance bands can help activate postural muscles. Body-centering exercises, focusing on finding your balance point, are great. And techniques like the Alexander technique are specifically designed to help people, especially performers, release habitual tension and find easier, more efficient posture and movement patterns. Regularly checking your alignment in a mirror or against a wall throughout the day helps too.
Right, bringing awareness to it. Which leads us to the third pillar you mentioned, the mind. It's clear the physical foundation is key, but you've also talked a lot about the mental side. How do the sources really connect the mind to physical tension in singing?
This is where mind over muscle becomes absolutely essential. The sources are very clear and consistent on this. Your mind plays a powerful, direct role in both creating and releasing physical tension. Psychological factors, things like stress, anxiety, fear of judgment, negative thought patterns, they don't just stay in your head. They manifest physically in your muscles, especially, it seems, in the muscles we use for voice and breathing.
Can you explain that link? How does anxiety turn into tight throat muscles?
Well, there's a well-documented anxiety tension loop. Think about performance anxiety or stage fright. What are the common symptoms? Racing heart, shaky hands, maybe butterflies in your stomach, and often a shaky or tight feeling voice. Research actually shows that this stress response causes measurable tightening in the laryngeal muscles and other muscles involved in singing, like the neck and jaw. So the anxiety causes physical tension. Then that physical tension makes singing feel harder, it reduces your control and flexibility, makes you more prone to vocal cracks or mistakes. And then, if you have a poor performance because of that tension, it fuels more anxiety about the next time you have to sing.
Creating a vicious cycle.
Exactly. Anxiety leads to tension, tension leads to performance issues lead to more anxiety. This cycle can be triggered by all sorts of things. Fear of being judged, fear of failure, dwelling on past negative experiences, lack of confidence, perfectionism, even deeper emotional factors or trauma.
That makes sense.
And here's a crucial point that came up in the sources, that laryngeal tension triggered by stress or anxiety can actually persist physically for a while, even after the mental feeling of anxiety has maybe lessened. The muscles can stay tight. This is why just telling yourself to calm down might not be enough. You often need physical release techniques, too, to let go of that residual tension.
Okay, so knowing this powerful mind-body connection exists, what's in the mental toolkit? What strategies do the sources suggest to help manage this link between thoughts, feelings, and physical tension?
There are several really valuable strategies mentioned. First, visualization or mental rehearsal. This isn't just wishful thinking. It's about actively, vividly imagining a successful performance or singing experience. Picture yourself walking confidently onto the stage, feeling fully prepared, your body feeling aligned and easy, your breath flowing smoothly, your voice responding just how you want it to. Imagine connecting with the audience, expressing the music fully, maybe even handling any small, unexpected bumps gracefully. Crucially, focus on the positive feelings associated with this image, the joy of singing, the connection, the satisfaction, the pride. Doing this regularly helps build confidence and actually trains your brain pathways for a positive outcome.
Like rehearsing in your mind.
Exactly. Then there's cognitive reframing or restructuring. This draws heavily from cognitive behavioral therapy, CBT principles. It's about learning to identify those negative, often automatic, distorted thoughts that pop into your head. I'm going to mess up. My high notes won't work today. Everyone will think I sound awful. Once you identify them, you challenge their validity. Ask yourself, is this thought 100% true? What's the evidence? What's a more realistic, balanced perspective? Then you actively replace them with more realistic, constructive thoughts. I've practiced this piece thoroughly. I'm prepared. My voice has been reliable in practice. I trust my technique. The audience is actually hoping I do well. They want to enjoy the music.
Changing the internal script.
Precisely. And a really powerful reframe mention is consciously interpreting the physical symptoms of anxiety, like the racing heart, the butterflies, not as signs of impending doom, but as excitement and energy that you can actually harness and channel into your performance. This fundamentally changes your relationship to those feelings and reduces their negative power.
That's a great shift in perspective.
It is. Then we have mindfulness and relaxation practices, especially useful right before performing or practicing. Techniques like deep, slow breathing, that 4-7-8 pattern we mentioned, inhale 4, hold 7, exhale 8, is very effective for calming the nervous system. Guided meditation, simple body scans, bringing awareness to different parts of your body without judgment, or progressive muscle relaxation, tensing and releasing muscle groups can all help. These practices activate your parasympathetic nervous system, your body's rest and digest mode, counteracting the fight or flight stress response. Simply focusing your attention on the present moment, the physical sensation of your breath, the feeling of your feet on the floor, helps pull your mind away from anxious future worrying.
Being present.
Exactly. Related to this is acceptance, which comes from acceptance and commitment therapy, ACT. This involves acknowledging anxious thoughts or uncomfortable physical sensations when they arise, but without struggling against them or judging yourself for having them. You simply notice them, maybe label them, there's that fear of cracking thought again, allow them to be there like passing clouds, and gently redirect your focus back to your singing, your breath, the music. Paradoxically, accepting the feeling often reduces its intensity because you stop fueling it with resistance. Accepting that slight imperfections are a normal part of live performance also helps alleviate that crushing pressure of needing to be perfect.
Letting go of the struggle.
Yes, and then there are positive affirmations, regularly repeating positive present tense statements about your abilities, your preparation, your enjoyment of singing. Things like, I am capable and prepared, I have a unique and valuable voice, I enjoy the process of sharing my music. This can help counteract habitual negative self-talk and gradually build a more confident internal narrative.
Reinforcing the positive.
And finally, self-compassion. This is about treating yourself with the same kindness, understanding, and support that you would offer a good friend who is struggling, especially when you face challenges, make mistakes, or feel anxious. Recognize that feeling nervous or not being perfect is a normal, shared human experience. It reduces self-criticism, feelings of isolation, and helps you bounce back more easily.
That's so important. It sounds like there are immediate tools, but also longer-term strategies for building confidence.
Absolutely. Beyond the in-the-moment techniques, the sources emphasize building vocal confidence and a resilient mindset over time. Number one, almost universally agreed upon, is thorough preparation. Knowing your music inside and out, the notes, rhythms, lyrics, harmonies, the interpretation, the story you want to tell is probably the single most potent antidote to performance anxiety. Deep familiarity builds genuine confidence, reduces the fear of forgetting or making major mistakes, and allows your performance to flow more automatically, even under pressure. It creates a sense of predictability and control, which directly counters the uncertainty that fuels anxiety.
Preparation is key.
Definitely. Another strategy is gradual exposure or desensitization. This means systematically putting yourself in performance situations, starting with very low-stakes ones, singing for a trusted friend or family member, maybe a small, informal group, and gradually working your way up to more challenging settings, larger audiences, more formal situations, auditions. This process helps desensitize your body's fear response over time. Repeated positive or at least manageable experiences build confidence and provide real-world evidence that your worst fears usually don't materialize.
Facing the fear, bit by bit.
Exactly. Also, shifting your focus to expression and storytelling. Try to consciously move your mental focus away from constant self-evaluation. How am I sounding? Was that note perfect? And instead, pour your energy into communicating the song's message, embodying the character, or sharing the emotion. Engaging fully with the why of your singing gets you out of your own head and reduces internal judgment.
Connecting with the music.
Yes. Setting realistic expectations is also crucial. Perfectionism is a major anxiety trigger. Instead of aiming for flawless execution every single time, which is impossible, set achievable goals focused on progress, connection with the audience, maybe nailing a specific technical aspect you've been working on, or simply enjoying the experience. Learn to accept that mistakes are a natural, inevitable part of both learning and performing.
Letting go of perfectionism.
It's liberating. And finally, developing a range of healthy coping mechanisms. Build your personal toolkit. Beyond the mental strategies, maybe this includes journaling, regular exercise, great for stress release, connecting with supportive peers or mentors, consciously reminding yourself of past successes and strengths. And remember, the act of singing itself, especially in a supportive environment or as part of a group like a choir, has been shown by research to lower cortisol levels and act as a natural stress reliever. Sometimes the best thing for performance anxiety is more singing in the right context.
That's fantastic. Okay, so we've covered the physical structure and mechanics with posture, the breath as the power source, we've mapped out the common places tension hides, and we've explored this really powerful link between the mind and the body. That is a lot of ground covered. How do you start to bring all of this together? How does someone actually begin walking this path towards more effortless singing? It really does sound like a journey, not something you just fix overnight.
It absolutely is a journey, and the sources are very clear about that. There's no magic bullet. It requires consistent effort, definitely patience, and that holistic perspective we keep coming back to, understanding that your physical body, your breath, your mind, your emotions, they're all interconnected and influence your voice.
So consistency and patience are key ingredients.
Paramount. Releasing deeply ingrained physical tension patterns or habitual negative thought loops, and establishing new, healthier habits that takes time. It takes repetition. Muscle memory, both physical and mental, needs consistent practice to change. Short, focused practice sessions done daily are often far more effective for building new habits than infrequent marathon sessions. And you have to accept that progress will likely be gradual, probably with some steps forward and maybe some steps back along the way. Be patient with yourself.
And maintaining that holistic view is important too, right? Not just focusing on one thing.
Yes, the holistic approach is essential. because your voice is influenced by your whole being. Trying to address just one symptom in isolation, say, trying really hard to relax your jaw without also looking at potential underlying issues like your breath support, your posture, or maybe performance anxiety, well, that's likely to yield only limited or temporary results.
Right, the jaw might just tighten up again if the root cause isn't addressed.
This exactly. Effective vocal training and tension release strategies really need to integrate all the pieces. Working on posture and alignment, refining breath mechanics and control, using targeted physical release exercises for specific tight spots, developing resonance awareness, ensuring clear and easy articulation, and employing those psychological strategies to manage stress and build confidence. It's about bringing the whole system into better balance.
And there must be times when just working on your own with self-awareness and practice isn't quite enough, or maybe even risky if you're dealing with pain. Knowing when to seek professional help seems really important too.
It is crucial. Self-awareness and consistent personal practice are invaluable tools, but qualified professionals can often significantly accelerate your progress, provide personalized feedback you might miss on your own, ensure you're practicing correctly, and help you avoid developing new problems or making existing ones worse.
So who should people consider seeing?
Well, a skilled voice teacher who understands vocal function and tension release is often the best starting point. They can provide a personalized diagnosis of your specific tension patterns and their likely causes, tailor exercises specifically to your needs, and guide your overall technical development in a healthy way.
Okay.
But for certain issues, other specialists might be needed. If you're experiencing persistent focal pain, chronic tension that just doesn't seem to resolve with good practice, if you've been diagnosed with a vocal pathology like nodules, if you have significant TMJ jaw joint problems, complex postural issues that affect your whole body, or deep psychological blocks like severe performance anxiety or past trauma that seems linked to your voice, then it's wise to seek help from other professionals.
Like who?
This could include a speech-language pathologist, SLP, especially one specializing in voice disorders, sometimes called a voice therapist. They have a deep knowledge of vocal anatomy, physiology, and pathologies, and are experts in voice rehabilitation. A physiotherapist or physical therapist, particularly one with experience in manual therapy, maybe specializing in head, neck, and jaw issues, or someone skilled in assessing and treating underlying postural imbalances. An otolaryngologist, ENT, which is an ear, nose, and throat doctor, often one specializing in laryngology, the voice box. They can medically evaluate your vocal folds and larynx to rule out or diagnose any structural or medical issues. A psychotherapist, counselor, or psychologist, especially if significant performance anxiety, general anxiety, depression, or past trauma seem to be a major factor contributing to your vocal tension and holding you back. As mentioned before, an Alexander Technique practitioner. They offer profound work on improving body awareness, releasing habitual tension patterns in posture and movement, which can translate incredibly powerfully to freer singing.
That's a great overview of the potential team approach. So ultimately, what does embracing vocal freedom really mean? It sounds like it's more than just singing without tension or having perfect technique.
It really is. The ultimate goal, as portrayed in these sources, is about liberating your unique, authentic voice. It's about allowing yourself to move beyond consciously thinking about every little muscle and instead focusing entirely on genuine musical expression and emotional communication.
Right.
A voice that's operating with this kind of freedom feels resonant, feels flexible, it can be powerful yet feel effortless to produce. It can convey subtle nuances of emotion and connect deeply with the listener. Importantly, it feels good to the singer to produce that sound. It reflects your true vocal identity.
And that involves releasing more than just muscle tightness.
Yes, it involves releasing not just the physical constrictions, but also any limiting beliefs, fears, or inhibitions that might be holding you back from full self-expression through your voice. It represents a shift, really, moving from that stage of conscious, sometimes effortful control while you're learning the mechanics, to a state of embodied, reflexive skill where your body naturally knows how to sing freely and efficiently without needing constant micromanagement from your conscious brain.
So the technique becomes second nature.
Exactly. The integration of all the parts, the aligned body, the managed breath, the clear mind, the open heart, makes the technique almost disappear into the background, paving the way for spontaneous, heartfelt, and truly free expression.
That really brings it all together beautifully. This has been such a rich deep dive. We've seen how vocal tension is incredibly complex, often a symptom of the body trying to compensate. And it can show up everywhere from the jaw and tongue to the neck, shoulders, larynx, even posture and breath control itself. And addressing it really does require this multi-pronged approach, building that foundation of breath, posture, and awareness, using targeted physical exercises like massage, stretches, and those SOVT techniques, and crucially, weaving in mental strategies to manage anxiety, reframe thoughts, and build confidence.
It truly is a layered journey, as you said. It takes that consistent practice, patience, a good dose of self-compassion, and definitely the wisdom to know when seeking expert guidance is the next best step. But the potential reward, the ability to sing with genuine ease and freedom, is an incredible motivator for that effort, isn't it?
Absolutely. And ultimately, the goal isn't just about eliminating strain or achieving technical perfection. It feels like it's about finding and freeing your unique, authentic voice, allowing it to express itself fully without those physical or mental restrictions holding it back.
And as we've touched upon, the path towards achieving that vocal freedom often runs parallel to a path of deeper self-discovery and personal growth. Learning to release physical holding patterns can sometimes help release emotional or mental ones too, potentially leading to a greater sense of personal freedom that extends far beyond just the act of singing.
So here's a final thought for you to consider based on everything we've explored today. If physical tension in your voice can truly be a mirror reflecting your inner state, perhaps showing where you hold stress, fear, or maybe where you hold yourself back,
Right.
then how might cultivating physical release, consciously learning to let go of that tension in your body, also unlock something deeper within you? Could freeing your voice physically also help to free a part of yourself?
Something to ponder.
Definitely something to ponder. Thank you for providing the sources for this fascinating deep dive.